SIDS is the most common cause of death in children aged 1 month to 1 year. If you've just had a baby or have a baby that's less than a year old, you need to know these life-saving crucial steps in order to prevent SIDS, known as sudden infant death syndrome. Now, I know that term is scary, and trust me, parents who've gone through the experience will likely describe it as one of the, if not the worst experience of their life. There is no evidence to suggest that any babies who have died from SIDS have had any symptoms. Luckily, you can nearly eliminate the risk of SIDS through these easy and simple steps. I won't bore you with the details. I'll put down that link where you may read up on the technical side of it. I'll just give you the crux of the matter and how to make sure your new bundle of joy has a smooth journey. The safe sleeping position. Make sure you maintain the baby's safe sleeping position. This is where your baby lies on its back at the beginning of every nap, regardless of the time. It's best to create a routine out of this, so that make sure you do it from day one and keep repeating this, as babies who normally sleep on their backs but sometimes sleep on their front are at a higher risk of SIDS. Babies should always sleep in the same room as you for the first 6 months for sleep, day and night. The safest place for a baby to sleep is in their own separate sleep place, such as a cot free from obstacles. There are a few scenarios in which you should never go sleep with your baby. You or anyone in the bed has recently drunk any alcohol. 2. You or anyone in the bed smokes or the baby was exposed to smoking in pregnancy. You or anyone in the bed has taken any drugs or medications that make you feel drowsy. Your baby was born prematurely before 37 weeks of pregnancy or weighed under 2.5 kilograms or 5.5 pounds when they were born. In these scenarios, it's always best to put baby in their own sleep space, such as a cot. Never fall asleep on a sofa or armchair with your baby. The risk of SIDS is 50 times higher for babies when they fall asleep on a sofa or armchair with an adult. Babies really only need 2 items in their cot. 1, a firm, flat, waterproof mattress, and 2, lightweight bedding. You may have the desire to decorate your baby's cot and make it feel special, and you can go all out, as long as you make sure the area where your baby sleeps is clear for your bundle of joy to wiggle around in. When preparing your baby's sleep space, remember, no pillows or duvets, no cot bumpers, no soft toys or comforters, no weighted or bulky bedding, no products designed to keep your baby in one sleeping position such as wedges or straps. Make sure that the room temperature where your baby sleeps in is between 16 to 20 degrees Celsius. The risk of SIDS is higher in babies who get too hot. Remember, your baby can't control the environment in which they sleep. Make sure your baby is comfortable. It can be difficult to guess temperature, so use a room thermometer in the rooms where your baby sleeps. It may be a good idea to invest in one. Now, you still need to check in on your baby to see if they're too hot or too cold, as every individual is different. You can feel your baby's chest or the back of their neck. And you should remember that your baby's hands and feet are usually going to be colder than the rest of their body, and that's totally normal. If your baby's skin is too hot or sweaty, remove 1 or more layers of bedclothes or bedding. Breastfeed is possible even if you can't breastfeed every time. Now, this doesn't mean that you have to be able to breastfeed your baby exclusively. Even utilizing a combination of breastfeeding and formula feeding has been linked to a lower risk of SIDS, even if exclusive breastfeeding is linked to the lowest risk. Breastfeed your baby as much as possible is what we pediatricians advise the baby's parents anyway. Stop smoking. Now, I feel like this one is obvious, and a lot of you probably saw it coming. Smoking both whilst being pregnant and after your baby is born increases the risk of SIDS considerably. It can even create double or triple the amounts of risk. I'm probably the wrong person to suggest advice on how to quit smoking if you're struggling with it, as I'm not a professional in that area of medicine, but for your own health and for your baby's health, it would be advisable to seek out professional help for this. Through these easy to follow steps, you can reduce the chances that a tragedy happens and be better equipped if you know anyone that has recently welcomed a young one into their lives. If you like this content and would like to stay up to date on how to make your little one's journey as comfortable and safe as possible, do hit that subscribe button and feel free to ask any specific questions in the comment section down below.